Welcome back to another T1 Dialogues. I'm Jack, a type 1 diabetic co-creator with Pete, who's also a type 1 diabetic and CEO of Not Just a Patch. We interview the heroes of the diabetic community. Today, we are chatting to Anna and Michele from Oklahoma State Medical Center. Fantastic to see you guys. I'm really excited for this interview.
Thanks, Jackson. I love your radio voice, by the way, or is it the podcast voice? I think you could have been a radio announcer in a different universe. Anyway, thank you, Jackson, and welcome Anna and Michele. This is the third podcast Jackson and I have done in the last 2 weeks. We did one with a grant winner in the UK and a grant winner in Australia, and Anna and Michele at Oklahoma State University Medical Center. We're pleased to say that you guys were the winners of our North American grant. It was it was a process for us, actually. We ended up getting, I don't know, I think Jackson was around about 100 applicants, or was it more?
It was more.
Yeah. So that's total. That's across Australia. So we were pretty happy with that, with the number of applicants that we've got. And then it was a process for us to whittle them all down. And so congratulations, Oklahoma State Medical University Hospital. Well done, Anna and Michele. So, look, I'm going to hand it over to you both now to tell us a little bit about yourselves, and we'll start with you. Tell us a little bit about your career to date, how you got where you are now.
Okay. I am a registered dietitian and certified diabetes care and education specialist. I have a master's degree in nutrition and have ended up working at a hospital for several years. Became interested in diabetes, took the exam, and then actually 20 years ago this month, I moved to Oklahoma and got the job at Oklahoma State University Medical Center and have been working there ever since. It's a teaching hospital, so we have medical residents, family medicine, internal medicine, surgery, and other specialties as well. So part of our job is training the residents and the medical students, as well as nutrition students and nursing students and pharmacy students. So it's a teaching hospital. We do a lot of education and trying to keep our staff and our residents and students up to date, especially on technology and what's going on, especially in the world of diabetes.
Fantastic. Thank you, Anna. Michele, do you want to give us a little bit about your background?
Yeah, I would love to. Thank you for asking. So I actually also have my degree, my master's in nutrition. I'm also a registered dietitian. I work with Anna, and I actually came into working with her by being an intern for her when I originally went through the program, the dietetic program. And I just really, I loved working with the diabetes population as well as the other populations. And diabetes was not something on my horizon. I did not think I was going to be working with that population to the degree I am, but I've really come to love working with this population. So love my job and really excited about the grant and just in general, all the stuff that's coming up on the horizon for diabetes with, pumps and CGMs and everything. Really fantastic stuff.
Amazing. I think one of the things that struck me about your application was your focus on helping underprivileged patients. Do you want to tell us a little bit about that? And the reason it struck me was that, it's something I just have an awareness of the challenges in the US of people who are under or uninsured. And so I think that anytime I see people out there trying to help that group, I'm always pleased. And so that was the thing that struck me about your application, was that you did seem to have a genuine interest in helping people who didn't have the financial resources to maybe have the best care possible. And some of the worst stories that we hear are people sparing their insulin because they can't afford it. So they dose too low and they end up with DKA, or they end up passing away even, which is, in my mind, an absolute tragedy that anyone living in the Western world is dying from not being able to access insulin. In fact, anyone in the world, to be honest, like the concept of not having insulin available is terrible. But yeah, do you want to talk us through a little bit about like how this became your focus, please?
So the hospital where we work is in downtown Tulsa, and has traditionally been the hospital for the folks who are uninsured. So we have the whole hospital is very much geared towards care for anyone. We do not discriminate. We do not, kick people out. We don't push people away. So a few years after I started, my manager at the time wanted to do a class for people who had no insurance, because we have lots of different opportunities for education for people with insurance, but not a lot for people who don't. So since probably 2006, we've been doing a free class for people with diabetes once a month, and we still do that to this day. And so we have people who maybe speak Spanish or speak other languages, so we have translators available, and we have this class once a month. Another thing that we work with, especially with the medical residents, when the patients are in the hospital, we actually have a grant in the hospital where if a patient doesn't have insulin, doesn't have insurance, we can give them insulin to go home with. So they have about a month's supply, and then we can hook them up with a provider who can get them on a program, or perhaps help them get onto our state insurance or Medicare. So you've been using that for probably about 10 years. And then with the test strips thing, it's kind of funny. There was a nurse at the clinic, one of our clinics. We have a internal medicine clinic and family medicine clinic that refer to us, and is where our residents work. And there was a nurse at Family Med years and years ago, and we had talked about getting a grant for test strips back then. And just, it's a lot of work to get a grant, and most grants are not, they want you to do a lot more. And ours was just a simple grant to just get test strips to people, to be able to give someone, when we give them their insulin to go home with, we can give them a meter, give them 100 test strips so they can test for a month, 4 times a day. And then when they fall with their provider, that we can work on something else, or we can get them more test strips. So, Judy, I think about her all the time when especially when I opened your email that we had won this grant. I just thought about her, and you passed away a few years ago, so I'm not able to tell her, but I think she knows that you're the one who is helping us fulfill this dream that we had all those years ago.
Look, it's a small gesture on our behalf. We'd love to do more. Like, I think it's we're happy that it's making an impact, even if it's a little impact. So really happy to hear that. Who pays for the patients coming in uninsured? Who pays for those?
The hospital gets money from the state to care for folks who don't have insurance.
And so will that vary state by state, whether there's funding available for patients who aren't insured?
Yes, it varies hospital by hospital. So some hospitals will, especially some of our, we have a lot of Catholic hospitals in Tulsa, and so they're not-for-profit, and so they have a different type of, edict that they're passing, about how they operate. And so they typically are more apt to take people who don't have insurance. They, a certain percentage they will definitely do. And the other hospitals who are not Catholic hospitals will do it as well. So typically that's how it works, that the administration figures out how much they can spend, and they kind of go from there. So it depends on the hospital.
So that's kind of nice to hear. I think the perception that I had, and I think it's quite common outside the US, is that if you don't have insurance, you get kicked out of the hospital. So it's actually reassuring to know that that's not necessarily the reality.
Yeah, we have a law that requires, no one can be kicked out of the hospital if they have an emergency situation, at least.
I love what you guys are doing around the test strips. It's a simple solution for better management. As we've established, insulin is essential for survival, anyone with diabetes, but blood glucose monitoring is essential for the management. And I know back in the day, it drove me, well, I'm on a CGM now, but it drove me nuts with test strips. And I think you said at some point that they originally only got 10 test strips. And I swear 1 in 10 never works, and it drives me nuts. So I couldn't imagine the anxiety around only taking 10 test strips home, considering I need to know my blood before I can even sleep. I think what you're doing is a simple solution for a greater management overall, focusing on those test strips. Yeah.
Well, we didn't want people to feel like they had to really not monitor because they needed that money for other things. And so the companies that make the meters are very generous with sending free meters. So we get lots of free meters, and we can get free Lancets. But it's the test strips that are really the problem. So being able to give people 100 to go home with, so that they feel comfortable. And like you said, if they end up messing up a couple of strips or something happens, sometimes you do have a dud in the box. So it's nice to be able to have that, so they have that peace of mind.
Definitely. I love what you guys are doing. And you also spoke about that it's an education hospital. Who are you educating exactly? Who's this hospital educating? Because you also did mention the free classes for the diabetics.
Michele, do you want to talk about the free class since that's your thing?
Yeah, so the free class is once a month, like Anna kind of mentioned. We try to make it the same, like third Wednesday of every month. And then we just let the providers know the patients need a referral, but it's completely free. We do have some free clinics in town that the patients can go to if they can't afford to go to a pain clinic. And they'll get a referral from their primary doctor there. Then once we get the referral, we schedule a patient, and everything is free. Free educational diabetes, free meters. We show them how to use them. And it's just a really great resource. I'm not sure, Anna, are we the only place in Tulsa that does that? Yeah, so I think we're the only one.
Yeah, wow. That's essential. Otherwise, no one knows what they're doing.
It's a tough gig, I think, being a healthcare professional sometimes. I've worked in and around healthcare for my career, but never at the coalface. I've never been a clinician but I've got a lot of admiration and respect for clinicians. And I think the COVID experience heightened my admiration and respect. And I think that it's just fantastic what you're doing. I think that the rewards aren't always as much as they should be across the board for people in healthcare. And I think it's probably getting tougher. I don't think it's necessarily getting any easier for you and physicians that you work with. I think that with the public access to information, people coming in thinking they know everything and they want to tell you what your job is, I think that stuff is, it is making your lives a lot harder. So, I think, again, it's a small gesture, but just a huge thank you from us for the work that you do, for the work that your colleagues do, for the work that really everyone does for healthcare in general, but again, specific to the diabetes space, because that's what we care about most here. We're just super grateful to have people like you in the community going to work each day and helping people like Jackson and I and, other less fortunate people with diabetes out there. So a big thank you once again for your work. Jackson, is there anything else you wanted to cover off before we sign off?
As long as Anna and Michele know how much of a hero they are to the diabetic community, you are changing lives every day. And we saw it in your application that you are going above and beyond to improve the community. And that's a thank you from the bottom of our hearts. How can more people find out more information, especially if they're in Oklahoma and if they're listening to this?
That's a really good question. The hospital does have a website. It's osumc.com. So Oklahoma State University Medical Center. The American Diabetes Association has a fantastic website, diabetes.org, and they can go on there and find programs. So that if they're wanting to learn more about diabetes and wanted to work with an educator, they can find accredited programs on diabetes.org, and also the diabetes educator, the ADCES, the Association of Diabetes Care and Education Specialists. They have a website that will have the programs that are accredited through them. Call your local hospital. You can call the health department. Any of these facilities might be able to hook you up with a diabetes educator or a dietitian or just someone if you need a physician. I think the main thing for people to realize is that there are programs out there for medications and for supplies for different things. And so don't feel like you have to ration. Don't feel like you have to not take your insulin or do anything like that, because, you need your insulin, you need a certain amount every day, and that's what you need. So I think kind of looking in the different programs that might be out there might be helpful.
Yeah, and I guess that's a key point, right? This occurred to me earlier when you were talking, and that is that the people who are, I guess, but dying from insulin sparing, partly it could be because of a lack of awareness of the availability of programs, and it's just they don't know about these programs, and it's that lack of education and awareness that's really as much maybe as cause, which is a shame, because I guess you and we are all doing our best to share this information. It's just, I think it's just an interesting point to think about, is that the awareness and education is as important as the funding, really.
Definitely. So seeking assistance rather than trying to figure it out all.
Yeah, or asking your healthcare providers, picking up the phone, calling your doctor and saying, hey, I need to get insulin. I think people maybe suffer in silence a bit too much.
Well, I think there's a lot of pride with it too. And, I think a lot of people, especially if you think about someone whose diabetes is not well managed, their blood sugars are running high. You know how you feel when that happens. You're kind of groggy, you're tired, your brain isn't really working on all 8 cylinders. So it's kind of hard to think 3 steps ahead and say, okay, well, maybe I should be doing this or that. So I think having programs out there, having people be able to know who to contact, and I think ADA is a good opportunity. But definitely, look online, find a hospital that has a diabetes education program, and just ask them, because we love to help people. That's kind of our job, and it's also our passion. So it's really a calling. So it's important that people know. Just ask. All we can do is say no, or maybe not this time, but if you don't ask, we're not going to know to call you to say, hey, we have all this extra insulin or something.
I was just going to add real quick. I think it's really important too that the patients understand that the attitude toward diabetes in the healthcare world is changing too. Slowly but surely, we're starting to acknowledge there's a lot more at play. It's not just the stereotypical lazy person disease and all of that. And so just kind of taking some of the stigma away from that and helping them understand it is a disease. It's not something that they need to feel guilty about. We have plenty of resources. And if you come to the educators, most of us now are not going to judge you and tell you can't have this food. We're going to talk about incorporating things in the way that works for you, whether that's culturally or however else.
Yeah, that awareness, that kind of sensitivity or political awareness around the terminology, I even had to be corrected by a diabetes nurse practitioner, a really experienced one, who corrected me on my attitude towards type 2. Because there was a point where I probably attributed lifestyle to be, a factor bigger than it was, bigger than it is. And I think understanding that, many people with type 2, they may have a relatively healthy lifestyle. And you can have 2 people, one person who has type 2 and has, a relatively healthy lifestyle, and one person who doesn't have type 2 but has an unhealthy lifestyle. So actually, the genetic components, the components out of control of the individual, it's important to be aware of that. And I think it does reduce the amount of stigma and judgment on that side. And I think we could probably go on and talk about stigma and judgment in the type 1 area as well. But yeah, that's a really good point to leave us with, Michele. Thank you.
Anna, Michele, thank you so much for joining us for this in-depth chat. It's been fantastic, and you're definitely worthy winners of the grant. Thank you so much.
Thank you.
Thanks again.
Access to education and blood test strips is essential for good diabetic management. And we are so fortunate to have people like Anna and Michele doing all they can to assist people with diabetes. If you're a specialist who requires some funding to get a program up and running or off the ground, please apply to this year's Not Just a Patch grant funding program. This interview is a podcast and a YouTube. Please like, subscribe, and leave a review. Your engagement with this kind of content will help it reach the people in need. I'm Jacobetic, and I'll catch you in the next episode.